Good morning, everyone. My name's Rob Forster. I'm the Acting Chief Executive at Wrightington, Wigan and Lee. Our foundation trusts, Wrightington, Wigan and Lee and Salford Royal, are two high-performing organisations based in adjacent geographical localities in Greater Manchester. Together, our combined population covers 650,000 people, and our combined workforce is over 11,000. We share consistent values with deep clinical, staff and patient engagement, which have received national recognition. In the last 2 years, we have strengthened our successful history of partnerships working, and we share the same world-class care record and health information system. Our boards have now decided that we should collaborate and work closer together and become the founding members of a new operating group which is nationally replicable, for which we are requesting Vanguard support. I would like to invite Sir David Dalton to describe our proposed venture, which we hope secures your support.
Thank you very much, Rob. Forgive me for using a script, but please don't mark me on my powers of oration. So I'm going to be looking at this. I pose a question. Why do we tolerate the extent of variation in our service standards and patient outcomes and efficiency between our organisations across the country? If we know the evidence of best practice, then surely you, should be capable of defining the service standards and organising reliable delivery against those standards. Now, we have NICE guidelines, and I know all trusts here today will be producing their own trust policies and submitting those into their organisation. But I put to you that I and you actually have no idea if the people in your organisation are actually adhering to those standards. And the consequence is that patients suffer from suboptimal treatment, some will die, and we will continue to preside over inefficient and unproductive organisations. Now, it's our contention that reliability can be assured through standardisation, and with an engaged and motivated workforce, we can use evidence-based care pathways of our electronic healthcare system to support clinicians' decision-making, to enable them to develop standardised care pathways that will support them to determine and advise on the tests and treatments required and the algorithms for prescribing. This system can also ensure just-in-time ordering of consumables for the length of stay of our patients. And most importantly, it can determine in real time the skills and staffing needs based upon the assessed dependency of every patient every hour. Now, we are delivering a coalition of globally leading industry support, organisations who have invested a considerable amount of money in technical solutions which are already being deployed in a number of places across the world, but not yet in England. So we need to deliver standardisation at scale. First, as a means of securing investment, we need that scale. And second, to spread benefits to patients by replication in multiple organisations. Now, it's my belief that having 240 organisations in our National Health Service, or 15 organisations in Greater Manchester, is no longer an affordable or sensible way of delivering reliable care at lower cost. If we want to, and if we're really serious about reducing variation and delivering better outcomes and improved efficiency, then we must use different approaches. And the approach that we are interested in is developing an operating group. And it's designed to allow the benefits of standardisation to be achieved at scale. Now, Wigan, Wrightington and Lee Trust is the Health Service Trust of Health Service Journal Trust of the Year, and Salford Royal is one of only two that's been rated outstanding by CQC. So we represent two of the country's most successful organisations, and we already have many cultural assets, and we share similar cultural styles, based upon our approach to patient and carer engagement, based upon our values, leadership, with deep clinical staff involvement and deference to their expertise. So we want to start, the two of us, two organisations, the formation of an operating group to develop a standardised operating system and to deploy this at scale. Now, we envisage our group, starting with the two of us, to operate in the northwest of England and have population coverage of up to 2 million. And over time, we see this group cluster likely to include between 5 and 8 organisations. Now, let me be clear, a group is not a traditional merger or acquisition. Foundation trusts would continue to belong to a group, retaining their public membership, but ceding some sovereignty to a group board, and that board determines the standard operating systems and assures that they are reliably used. We envisage that Group Co would also take responsibility for investment, asset management, and strategic service changes, supporting the development of care models, harmonising our policies, both vertically in a locality and horizontally across trusts in the group. Group Co would consolidate both back office functions and clinical support services, and would organise the delivery of all of the Carter Review recommendations. Now, our proposal is to begin that group in Wigan and Salford through the creation of 2 integrated care organisations using an accountable care organisation type of structure to include all hospital, community, social care and primary care within a single system of governance and with responsibility for population health. We want to work with NHS England to develop population health management systems and over time see the transfer of responsibility of current commissioning arrangements to each accountable care organisation. We want to develop with NHS England and our regulators appropriate arrangements for the new legal framework and accountability arrangements. An early priority for our 2 accountable care organisations will be to target a 20% reduction 20% improvement in efficiency and a 20% reduction of acute beds by developing at-home or close-to-home alternatives. We believe it is possible to reduce acute beds by about 20%, which would take out about 1,000 beds across a group of 6 hospitals. And taking these assets off the group's balance sheet will be one of the speediest ways of liberating cash within the system. Now, we want our Vanguard project to deliver value to the NHS, and we've committed to work with colleagues, foundation trusts in both Northumbria and the Royal Free in London, to develop a knowledge management and solutions creation hub so that we can share learning and organise its replication across our 3 localities in the country. So, let me summarise. The project is radical. It is a new approach to reduce variation in patient outcomes and to deliver reliability at scale through the standardisation of clinical pathways and in coalition with industry partners. We will pursue value-based leadership across all elements of our group, and we will ensure that benefit can be delivered at scale. Both Rob and I hope that we secure your votes as a Vanguard bid to prototype a new organisational approach with standardisation at scale so that we can deliver better care and well-being at lower cost and spread our learning across the country. Thank you.
Thank you very much. Now time for questions for Salford and Wigan.
My name's Brent McInerney. I volunteer in a voluntary community organisation in Gloucester City, working with quite vulnerable people, and very proud and privileged to do that. Could I just make a plea for all the presentations today, really, and that's to expand the acronyms. We talked about NICE, we talked about the CQC, etc. But again, from Sam's presentation, it was very clear that we've got people beyond the NHS in this room. So that's just a plea for all the presentations, please. What didn't come out very explicitly from the presentations is about how you're going to involve patients, carers, families, etc. in your work, and how you're going to ensure those shared values are shared across to people in community groups beyond some of the organisations you mentioned. It just didn't come out explicitly enough.
Thank you very much, and forgive me, in 7 minutes it's hard to do that. So to give you an example of how we're developing the accountable care organisation approach within one of those localities, we have agreed to have our focus on neighbourhoods in our community, where we will see an accountable officer, probably be a general practitioner, who will be working with our voluntary organisations, our community assets, as well as the social care services in that area and all primary care practitioners, to really understand how we mobilise the community assets within that particular neighbourhood. So that's an approach which is 12 months in being, and it's already generating some fabulous ideas. Because it's the smaller organisations, not necessarily part of the statutory ones, who can take us to places that we can't get to. So we've begun to have conversations with a number of charities about how to contact some of our people who are usually hard to reach, and we've seen some great success in the way that we're organising now improvements for people who have difficulty with their relationship with alcohol, for instance.
Okay, we're moving over to this lady here, please.
Hi, Sarah Morgan from Guys and St Thomas's. Thank you, David and Rob, for your compelling presentation. There's a lot of work in Manchester and the Greater Manchester around devolution, and I just wondered how your proposal runs to complement the devolution work.
So our proposal developed before the devolution arrangements, but it's entirely consistent with it. To know the geography of our part of Greater Manchester, we are in the northwest of the conurbation, and it would be our intention that we can look both to the east into Greater Manchester and elsewhere to the west, if there are partners who would wish to join with us. So far, all our conversations have been with organisations within Greater Manchester about the development of a consolidated approach to the number of groups that may be formed within Greater Manchester.
Question from the gentleman over here.
Tony Brzezinski from Croydon. I just wanted to ask that if you were going to all this trouble to develop an ACO, why two and not one? That can't be integrated?
Because we strongly believe there is benefit in maintaining a focus on a locality having coterminous arrangements with local government. So the approach will be to develop accountable care organisations in a number of localities that would then have a single governance wrapper across them. So we're not intending to have one accountable care organisation for the group. I think it's really important, back to the gentleman's point earlier, that we have connectivity with people through our neighbourhood approach.
Thank you very much. We've only got 5 minutes of questions. I promise I will get to more people next time, but we now need to move on to the next applicant. The next applicant, thank you very much indeed, Salford and Wigan Foundation Chair.